So good morning, everybody. I'm TJ Flynn, Acting Director of Corporate Communications at the Region of Waterloo. I just want to say thank you to our media partners for attending this morning's briefing to receive an update on the Plan and Budget Beyond COVID Service Review Implementation Report. The report will be brought to Committee of the Whole on November the 17th and is being published on the region's website this morning. For members of our media, we can send you a copy of the report, and I would be happy to do that after this meeting. So on our panel this morning, we have Regional Chair Karen Redman, we have Regional CAO Bruce Lauckner, we have Commissioner of Community Services Douglas Bartholomew-Saunders, we have our Chief Financial Officer Craig Dyer, and we have Director of Community Services Barb, Cardow. And this morning we will hear remarks from Regional Chair Karen Redman as well as our CAO Bruce Lauckner, and there will be an opportunity for questions following remarks. So with that, I will hand things over to Chair Redman.
Thank you all for being here this morning. The Region of Waterloo has led a collaborative effort to navigate the community through COVID-19 pandemic since early 2020. Our day-to-day responses to rapidly evolving pandemic have been swift and effective. We are in unfamiliar territory with many decisions being made and acted upon in real time. During the height of the pandemic, the Region of Waterloo turned recreation centers, churches, and hotels into temporary shelters, provided free transit to essential workers, and coordinated free emergency childcare for healthcare and other essential workers in our communities. Drastic cost containment measures were taken to offset revenue shortfalls while the pandemic-related costs increased. Like many municipalities across Ontario, these included laying off staff, pausing non-essential services, and reducing transit service to reflect demand. The region continues to find ways of improving and streamlining critical services such as water, transportation, community services, public health, and paramedic services on a daily basis. In the spring, we launched a dynamic and comprehensive website and pandemic dashboard to communicate up-to-date pandemic statistics. In July, Council adopted one of the first municipal mask bylaws. Across the transit system, enhanced cleaning of vehicles, plexiglass for operators, and masking of passengers is commonplace, ensuring a safer environment for staff and passengers, and these protocols continue. These are examples of how we have navigated our way diligently and nimbly through the pandemic, but we are still in unprecedented times. We're grateful to the federal and provincial governments who have provided the Safe Restart funding, almost $30 million to the Region of Waterloo. That has been critical to our 2020 budget year. However, we are now projecting close to a $25 million gap between the expenditures and revenues in 2021. To provide leadership of our 600,000 residents, we must look at 2021 and beyond and not rely on the support from upper levels of government. Based on Council direction, the strategic plan that staff have presented Council through the budget and a report to committee next week titled Plan and Budget Beyond COVID-19 shows our commitment to all community members, placing high importance on the most vulnerable and our impacted workforce. Community engagement is at an all-time high. We saw thousands march in the streets in June to support Black Lives Matter. The plan addresses inequities in our community through additional investments to support BIPOC residents, as well as stronger focus on addressing the calls to action in the Truth and Reconciliation Commission of Canada. I hope the community remains as engaged and committed through the budget process. There are a number of opportunities for engagement, including a special committee meeting on November the 18th for further consideration of the service review and recommendations, and to hear delegations. Because the recommendations on the service review will have an effect on the preliminary 2021 budget, it is critical Council make a decision in advance of budget deliberations. Council will make sure its final decision on the service review recommendations after further consultation at a special Council meeting on December the 2nd. I would now ask Bruce Lauckner, CAO, to give you more details on the 2021 Plan Beyond COVID-19, including the recommendations coming out of the Service Review Committee.
Great, thanks very much, Karen, and good morning to all of you. Really appreciate you joining us this morning. It's super important. I know many of you, and you know I'm a big supporter of local media to help us get information out to our residents. So, as Karen said, there's no doubt the pandemic has resulted in unprecedented pressure on most organizations around the world, and the region of Waterloo is no different. I had a different seat a few months ago at Ontario Health and watched the region lead the community through the pandemic since March. And you know, their approach was very proactive, very nimble, and super proud to be part of this community. We had to shift gears quickly, and that helped lead us through 2020. Karen mentioned some examples. I'll mention a few more. We had Grand River staff, transit staff, redeployed to help us out at Sunnyside Long-Term Care Home. Other Grand River Transit staff were able to help us with our paramedic services. We had technicians from our print shop move to community services and so on. And that was super important, again, from a health perspective and a safety perspective. The region was able to step in and protect our most vulnerable in places like our long-term care homes and our shelters. And now we're starting to look ahead to 2021 and even into 2022. And I want to talk to you more about that plan. As Chair Redman said, there isn't an organization in the world that hasn't been impacted by COVID, and we're no different. We have that $25 million gap between expenditures and revenues. And for an organization like ours and the services that people rely on, that's really significant. And if that weren't enough in any given year, that would be a big enough challenge. But the pandemic has also really highlighted the problems that we all know existed in the community before COVID. And COVID, in fact, has made many of those worse. Before COVID came, we had an affordable housing problem, and COVID has definitely exacerbated that need. We've had inequity problems, we've had systemic racism in this community, and COVID has highlighted that and made it even worse. And we've had small business owners struggling to make ends meet. And again, I think most of us on this call have friends or family members who have been affected by that, where businesses have gone under or people have lost jobs. So in a nutshell, you know, our community is hurting right now, and we have an opportunity going into our 2021 plan to really make a difference. And that means making choices. Many of them are difficult, and council will have to reflect on what are the right choices, remembering that the choices are about 600,000 people who we support and provide service to. And that makes it even more complicated. The needs of some people may be different than the needs of others. So council is looking at this as a whole and all 600,000 residents in our 4 townships and our 3 cities to understand how to move forward and how best to move forward, both in terms of a plan and budget. So when we talk about you know, what we're looking at, I reference the businesses that give our communities that sense of place. I'm talking about parks, I'm talking about recreation facilities, I'm talking about the mothers and their children who need access to housing, who need access to food, and our partnerships with organizations like the food bank, referring to the restaurants and you know, those elements of our towns and our villages, our markets that give us the vibrancy of, you know, city life and small town charm as well, and of course our farming community, our agriculture community, and the needs of our rural residents. And at the same time as all this is going on, we have to continue to provide services like clean water. We have increasing demands on our paramedic services, our opioid crisis, you know, far too well, additional demands on housing and social services, and keeping our roads plowed and more. So what are we doing going forward? What is the plan? You'll hear more in the coming weeks from Mr. Dyer, who's on the call today, at our budget deliberations, and again in the coming weeks and through to December and January. Give you a sense, one of our first areas of focus is on trying to control this disease. We've added at least 90 new staff who are solely focused on contact tracing and pandemic control. And I can tell you that's not enough. This is growing and growing and growing. And the challenge that we have, like all parts of the country, we can't find enough people to do this clinical work, and we can't just have anyone doing this work. Contact tracing is a specialization that requires clinicians to do that work. So that's an investment that council has made. Again, maybe an easy decision from a COVID perspective, but a difficult decision in that we only have so much money, and that means that something else may be affected. And as I said, council in the coming weeks will start to deliberate on the budget for 2021. To give you a bit of a sneak peek on the areas that council has asked us to focus on, continuing to deliver things like safe water and those paramedic services, ongoing management of COVID-19, supporting our most vulnerable through additional investments in affordable housing. And if the recommendations staff are putting forward to council are supported, you will see considerable investment in affordable housing, which is a huge need. And addressing inequities in our community through additional investments to support Black, Indigenous, and people of color, and a stronger focus on addressing the calls to action in the Truth and Reconciliation Commission of Canada. As well, looking at the region, we've been a very stable organization. We need to streamline our service provision and ensure that as many dollars go to frontline care as possible, or frontline service as possible, and that means investments in modernization, investments in technology, that result in enhanced service for residents, as well as financial savings. We don't anticipate this problem will go away next year, and we are preparing for 2022 with potentially a more significant challenge as both the federal and provincial governments tighten their belts. So, I wish there was a money tree outside our window. There isn't, and we know that higher taxes aren't the answer, and that has negative impact on businesses and so on. So council has a lot of challenging discussions and decisions ahead of them. One of those, as the chair mentioned, is what to do with the service review that KPMG did in 2019, as well as some more detailed reviews that followed. The KPMG review identified a number of areas where we're delivering services that aren't within our mandate or delivered at a higher cost, well above the norm, and so on. And you'll see in the report that's being released this morning that there's 19 areas that KPMG recommended that we investigate. And at this point in time, staff have been able to make recommendations in 5 of those areas. And those are childcare operations, museum services, facilities management services. So that's our buildings that we manage, specialized public transit, and multimedia services. I'll use childcare as an example. We are the system manager, and we oversee 14,000 childcare spaces in the region that are provided by 67 providers. We also happen to be a small provider. The challenge that KPMG has identified is that we provide 1.9% of those spaces and use 10% of the overall budget. So that's a massive amount of our budget for a very small amount of spaces. And there are challenges that we'll speak to in terms of the system itself and the fragility of that system. I want to emphasize again, as the chair did, that this is the beginning of the budget process. We've been working for months in terms of trying to pull together prudent recommendations that take into consideration the balance of trying to keep our tax increases minimal and as close to zero as possible, knowing so many people are suffering at this point in time, while also dealing with the reality that 600,000 residents need service as well. Other things we're doing internally, we've initiated a voluntary exit program for individuals who may be close to retirement in our organization and desire to leave, as we downsize some parts of our organization and shift resources again to areas of highest priority. I don't say that lightly. No one wants to cut or reduce service. Certainly, as I came into the region 3 months in, it's not something that I had hoped would have to happen, but the reality is, with a $25 million deficit, we need to make prudent decisions going forward. We're confident that with this plan that we've put forward, again, focusing on the demands of our community and growing demands, particularly the vulnerable, BIPOC, our Black, Indigenous, and residents of color, and continuing transit and water and so on, that we're going to come out of COVID as a stronger community. We're certainly not shrinking away from the challenge, and council and staff and the community need to be united moving forward. So with that, TJ, back to you, and thanks very much.
Thank you, Bruce, and thank you, Chair Redman, for your remarks. And we'll now open it up for questions and answers from members of the media.
Has the report been sent out yet? It's kind of difficult to ask specific questions.
I've got an update on that, Joanna. Yeah, the report should be just about published on the region's website right about now. We expected it to be up at about 9 a.m. this morning, and clerks are currently uploading that to our website.
Okay, can I just ask a question then, I guess, related to childcare then? It sounds like that's one of the areas that possibly the region will no longer be operating the 5 centers.
Sorry, Joanna, so the question is the fate of the 5 centers?
Yes.
Okay, so I appreciate that this is the beginning of the budget process, and this will all be subject to council's approval. But the region recognizes quality licensed childcare is vitally important to the recovery of our local economy, as well as the healthy child development. Childcare plays a particularly important role in parents' return to the workforce, especially mothers. And there is no doubt the impact on children's outcomes is especially important for vulnerable children. So the region is the service manager for licensed early learning and childcare, and we oversee, as Bruce has already said, about 14,000 childcare spaces. And this service is provided with 67 different childcare operators. And we do operate directly 5 centers. However, we're not mandated to provide the service. And as the service manager, we are responsible for the entire system and all the children in the system. COVID-19 has created significant challenges because there is lower enrollment for childcare providers across the region due to spacing requirements. And these challenges are impacting the sustainability of some childcare programs, and additional funding is now required to maintain childcare spaces. In order to protect a very fragile system and ensure a more equitable and affordable system, particularly for those who are most vulnerable, the region realizes that some difficult and prudent decisions need to be made. And I really just want to reiterate the statistic that Bruce already shared with you, and that's that the region's 5 childcare centers provide 1.9% of childcare spaces in the region, but take just over 10% of the child services budget. So it is an area that KPMG identified. It is not a new discussion that we've had, and one that I think will continue as we look past the pandemic and into budget 2021. I don't know, Bruce, if you want to add anything to that.
So I'll provide some broader context again, Joanna, and then jump into some more details on childcare. As a principle, council and staff are looking at our budget and our services, as well as a $25 million deficit through the lens of all 600,000 residents, and looking at each service individually in terms of trying to maximize the quality of care, the stability of care, and so on for all residents. So as I mentioned earlier, we oversee, as a service manager, 14,000 spaces delivered by 67 providers. And there currently is some availability, and the question becomes the stability of that overall system. So we're talking about 14,000 children here, and the stability of that system is at risk, significant risk. It's very fragile. So I know part of the story, if you look at this, you see, people will see, wait, there's a change over here. It's super important to talk about the entire picture, that this is 14,000 kids and their families and moms and dads who need to work in many cases and need childcare. We recognize that. So knowing that we are spending 10% of our budget on 1.9% of those children, well, almost 14,000 other children are in a system that's extremely fragile. We have a choice to make. And again, no decision made yet. Staff are recommending that we focus on all 14,000, including those who have currently received service from the region of Waterloo, who it's important that we, if council passes this, we continue to have conversations with those parents to transition them to the available spaces elsewhere, and look at that 10% of funding to do better by it. And specifically, the other part of the plan, you'll see this in the service review, is addressing the affordability of childcare. So improving the affordability of childcare for all 14,000 children and their families through things like subsidies or fee reductions. And again, we haven't taken those decisions yet. These are the recommendations, but that's the type of thing that we would invest that 10% of funding in. Fee reductions is an example. Supporting the sustainability of childcare programs through new funding to respond to system challenges, increasing quality of childcare across all 14,000 spaces instead of just a select group. And that's super important, we know. As a parent, I know childcare is important, and I want quality and equity across the system. And that last piece, both quality and an equity perspective. Equity is super important for those who are most vulnerable. So we need to engage communities on this before we decide. We're not going to decide what equity solutions look like. That's inappropriate. We need to engage members of the Black community, members of our Indigenous communities, other members of our community, to understand what their needs are, should council again decide to do this with that 10% of funding that we currently use on a fraction of our children. So again, I know parents will be anxious. Barb and Douglas are here. They had an opportunity to speak to parents. Our team will continue to speak to parents who no doubt will be anxious to transition them over time to new spaces. And then again, our focus on all 14,000 children, including those who we currently provide direct service to address those issues of affordability, equity, quality, and so on. Barb, I don't know if you have anything to add. If not, we can move on and see if there's more detailed questions we may need you for.
Yeah, no, I think you've covered it, Bruce.
Okay, thanks.
Can I ask a follow-up then?
Yeah.
So you're talking about, you mentioned that staff have been talking to parents about transitioning them to other spaces. So that kind of makes it sound like this is something that will be happening, that the centers will no longer be operated by the region. And if so, would they then close, or would someone else take them over?
Yeah, just to clarify, I'll start the first, and then Barbara Douglas can jump in. We're talking to parents, starting that conversation. If council did decide, we wanted to give them a heads up that this is coming to council. We didn't think it was fair to not notify them. So it's important to give them a heads up that this is coming to council for consideration, but also be clear what transition could look like, what the opportunities are, talk about these points that we talked about today, why, in terms of trying to improve affordability across all 14,000 spots, and have those very important conversations with parents. So that's the beginning. Just an update yesterday, but in the coming weeks, those conversations would need to continue, and certainly not concluding or prejudging what council might decide. We just want to make sure that everybody has as much information as possible as council deliberates on this potential.
Okay, thank you.
Thank you, Joanna. Do we have any other questions from our media partners? Go ahead, Fight.
Yes, I was going to ask, you guys have your priorities. I guess what major services are maybe on the chopping block or set to possibly see major cutbacks as part of these discussions?
Yeah, our focus is not on cutbacks. Again, childcare is a good example. Our focus is on sustainability of existing services. And childcare is a good example. All 14,000, including the 200 children who currently get care, if council decides this, would receive care still, but by a different provider. So we are not focused, and we're doing everything to minimize service reductions in all areas. With the exception of some changes that will have to happen in the delivery, like childcare and other specific areas where we are spending more than we may have to. So maybe I'll shift to a couple examples, and you'll see this in the service review. And apologies that it wasn't posted before we have this, but the model for museum services is another example where when we're realigning the hours to where the demand is. So we have staff working that we're paying when we don't have residents visiting the museum. So hours would reduce, but the impact on service is negligible because people aren't actually visiting the museum during that time. So we think that's a prudent decision to recommend to council, where it doesn't have an impact on service, but it certainly saves taxpayer dollars. Another example is facilities management, where we manage hundreds and hundreds of buildings. Some of those are in the affordable housing space, but some of those are regional buildings where we have staff. And like most organizations, maybe even many of you, working from home is here to stay in some respects. And I know there were plans to build potentially another building like this beside 150 Frederick. And instead, not only not build that building, but perhaps get out of some of our leases where we're renting and using taxpayer dollars to rent space and bringing people into our existing buildings as some of our staff work from home, perhaps for forever. So that's another example of savings. Graphic design, this is probably near and dear to your heart in multimedia. Some shifts that KPMG is recommending to move into more digital, and that may affect a small number of staff, but again, give us more modern capability in terms of video and multimedia and so on. So this is definitely a shifting budget to shift towards modernization, towards shift to try to free up dollars internally to maintain services, and then looking at different ways to deliver services to address the fragility in childcare that Karen talked about. Knowing that we can't do that the same way, we have to do it in a different way and rely perhaps on our partners, our 67 other partners, rather than providing it ourselves, which is very expensive and again, consuming a big portion of our budget. So I hope that answered the question. Happy to try again if not.
No, that does answer my question. I have one more question. Since we are planning for 2021 and possibly 2022, what assumptions are we kind of making within these budget discussions? Or, for example, how long the pandemic may last into the next year?
Yeah, and I might get Chair Redman and Mr. Dyer to jump in. So let's assume we get a vaccine. Even if the vaccine's issued in the late winter or spring, you know, the experts are telling us you still need it to take hold and so on. So I would be speculating, I think, if I tried to give a date, but we're certainly assuming that we will be through 2021 dealing with COVID in some form. Transit ridership is a good example where we have talked to our partners across the province and are estimating about an average of 55% revenue and ridership over the year. That doesn't mean we're 55% all the way. It's a lower amount, increasing to a higher amount through the summer, perhaps, or into the fall. But to expect huge ridership suddenly in the spring, we don't believe is on, even should a vaccine suddenly appear in the spring. It'll take some time. I don't know, Chair Redman or Craig, if you have anything you want to add.
Craig can probably speak to fees, sort of substantive detail. I would just say that we see our numbers going up. We really don't know the overall impact of the pandemic as we go into 2021. We know it's with us, but we don't really know those impacts. And I meet regularly with senior levels of government, and there is a reality that we keep asking for flexibility. We keep asking for more support, and to date, they've been there for us as a partner. I don't know how long that's going to last and what that's going to look like, but we do have to continue providing the services, the support to the 600,000 residents of Waterloo Region, because that's what they expect. And this is the time of greatest need. So I can only anticipate that revenue will continue to be questionable, and service and investment in the things that the community needs is going to go up. So I think that divide and that gap will continue, but Craig is better positioned to speak to that probably.
Yes, thank you, Chair Redman. To the comments that both Chair Redman and Mr. Lauckner have made, I would say that certainly as we put the 2021 budget together, we anticipate that we'll be impacted in a number of areas over the course of the year. The areas of most significance include transit, as already described, our public health resources and team, the operations of our Sunnyside long-term care home, paramedic services, as well as the significant impacts we've been experiencing through the homeless shelter system. And we expect all of those to continue to be impacted in some way for much of or all of 2021. And that requires us then to make a number of assumptions, both with respect to what we expect the costs will be, and to Chair Redman's point, the availability of provincial funding next year as the province deals with a significant deficit at their end.
Thank you for those answers, Chair Redman and Mr. Dyer. And we have, I think we have Heather from CTV that just joined, and it looks like Sean from the Woolwich Observer has left. Before we get to Heather, I have two questions from Hala at CBC. So the first question is, can you talk a little more about the deficit and why we're seeing those numbers? So I think this question refers to the $25 million figure that Mr. Lauckner mentioned earlier.
Craig, do you want to do that?
I can give that one a try. And maybe I'll just start with, before getting to 2021, just a quick recap of how things have played out in 2020. You may recall earlier this year, I think it was around June, when we made our initial deficit projections for the year, we were projecting an overall deficit range of $15 million. Despite a number of measures that the region took in order to contain costs, we still had that $15 million target. That was that challenge, for lack of a better term, was to a great extent solved with the introduction of the Safe Restart Fund and a significant inflow of federal and provincial funds, which was announced back in August, and which we've been working with the provincial government on for the last little while. So that for 2020 gets us into a much closer to a break-even position. The challenge in 2021 is, to a great extent, our budget is impacted in a few different ways. I'll say, as in any other year, inflationary impacts on service contracts, on materials, on staffing costs, on the major expenditure components of our budget. What's different in 2021 is the ongoing COVID impacts in those 4 or 5 areas that I just went through with transit being the most significant one from a revenue loss perspective. So we're in a situation where we have increased costs, reduced revenues, and an uncertain amount of provincial and federal funding. And some of that funding was given to us in 2020 that we can carry over into next year. But overall, we have estimated, once we take all that funding into account, a shortfall of approximately $25 million. And when I say shortfall, what I mean is that's the gap between where our budget would normally come in and the direction that council has given us to come in with a 0% property tax and user rate impact next year. So our work over the last 3 or 4 months has been to identify how we can bridge that gap. And I would say, specific to the report at hand, the KPMG service review report, the recommendations that you'll see in that report, which total approximately, $2.3 million in savings in 21. That's an integral part of our plan in order to bridge that gap and present to council a 0% budget later this month.
Thank you for that answer, Mr. Dyer. And the follow-up from Hala from CBC is, can we expect job losses due to downsizing?
I'll start. And Hala, sorry, I didn't see your questions in the chat room. My apologies. So we're still at the beginning of the process. So again, a couple of things that we're doing internally to try to minimize any impact or to minimize impact on staff are things like that voluntary exit opportunity. So that is a process that was launched recently. Staff have the opportunity to select that. And there's some conditions attached to that the position would not be refilled or another position in the area would not be filled. So in other words, we would go down an FTE and the individual would retire. I can't give you an exact number because people are still selecting their preference and we're going through that process as we speak. By December, we should have a better sense of what that looks like. We've also taken opportunity to really challenge management and staff to look at how can we do things more efficiently, and are there things that maybe we do that aren't the highest value use of taxpayer money. And in that sense, not replacing all vacant positions, replacing some, but not all. Also limiting hiring with the exception of absolutely essential roles that absolutely need to be filled. So that, in my view, is a more humane way, and I know in the leadership team's view, a more humane way to try to address these things in an attempt to avoid as many layoffs as possible. So at this point, the child care review is, if council approves that, has the most significant impact. There are potentially smaller number of vacancies and so on. And we have a very large organization. So although you may not fill a vacancy here or 2 vacancies there, when you start to add that up, 10 vacancies is $1 million, and you start to make headway on this very, very prudently. In all this, again, I don't want to lose the main plot of the budget and plan for 2021, which is shifting investments and significant investments in areas like affordable housing, services for the Black community, for Indigenous communities. And those are important decisions that council will be taking in the coming months as we invest what precious dollars we have in areas of highest priority. So the goal of this is to come out as a stronger community, a more equitable community, a community that is and a region that has put its its priorities and its budget, if you will. I'm hopeful and confident that you'll see a caring, thoughtful budget coming through this process in December and January. And again, there are service changes. And I go back to the one, childcare is the example where spending 10% of the budget on 1.9% needs to be looked at. And the recommendation is that we are better able to serve not only those existing children, but 14,000 children better, should council take a different decision on service delivery. So again, I think you'll see this is a thoughtful budget. That's my hope. But we're just at the beginning of the process, as Chair Redman has said, and a couple months to go still.
Thank you for that, Mr. Lauckner. And I'm going to ask Heather from CTV if she has any questions. I know she's trying to open the report at the moment. Heather, do you have any questions for the panel?
Sorry, because I'm so behind, I do not. I'm still trying to find out the information because I joined late. Apologies.
Okay, Joanna, you have another question. Go ahead, please.
Yeah, just given that we haven't had a chance to look closely at the report, will there be an opportunity this afternoon or later this morning as we do that to ask questions, or is this sort of our one opportunity today?
You can get in touch with me, Joanna, if you have any further questions, and we can work those answers out with you for sure.
Okay, thank you.
So one more opportunity for questions for the panelists from anybody. Hearing none. Oh, sorry. Go ahead.
I might have one. Has there been any consideration to the police services ask of $8 million in regards to these discussions?
So I'm happy to jump in, wearing both hats as chair of the Waterloo Regional Service or Police Service, as well as regional chair fee, just to say that these are early stages in everybody's budget. The police board takes very seriously its accountability to the community. So we directed the chief and his deputies to go back and find savings in other ways of delivering services that doesn't impact the legislated requirements that they have to keep this community safe. So it's early days, and we on the police board are very aware of the things that the Waterloo Region Council are doing to look at a 0% increase in the budget, or even considering a little bit of growth. So we're very aware of that, and we expect to see changes in the next iteration of the budget for police.
Thank you for that, Chair Redman. And another opportunity for a final question for our panel members. Thank you to everybody on the call here for making some time available this morning to discuss this issue. We appreciate everybody attending. And with that, we will say goodbye and have a good rest of the day.